This video will be on the appendicular muscles, the upper limbs, and the girdle. I am Jenny. First, we have the trapezius, which is the most superficial muscle of posterior thorax, very broad origin and insertion. It's one of my favorites because it's large and easy to identify. The origin is the occipital bone, ligamentum minucae, spines of C7 in all thoracic vertebrae. And the insertion is the acromion and spine of scapula, the lateral third of the clavicle. So as you can tell, that is a lot for the origin and insertion for this muscle. And so the action for this one, and I've circled the muscle also right there, but the action is that it stabilizes, elevates, rotates, and retracts scapula, and it also extends the head. The superior fibers elevate the scapula, as in shoulders shrugging. And here is a scapula where you can see some of the points where the trapezius is connecting to, like the insertion. Here we have a thoracic vertebrae, which is a point of origin for the trapezius. Finally, we have the trapezius labeled on a model, which is much easier to see than a lot of other muscles. Next, we have the levator scapulae, which is much more difficult to find and identify than the trapezius. It is located at the back and side of neck deep to the trapezius. Origin is the transverse processes of C1 through C4, and the insertion is the medial border of the scapula, superior to the spine. So this is underneath the trapezius. And there it's outlined. The actions for the levator scapulae, so as they would imply, they elevate the scapula, and they also adduct the scapula, which means that they bring it closer to the midline, and they laterally flex the neck. Here we have a scapula so that you can see the medial border superior to the spine. Then we have a C1 or atlas vertebrae, and you can see the transverse process. This is another view of that. And then we have C2 or axis transverse process. And we have a model, and again, it's hard to see because it's kind of underneath the trapezius, and the models don't go as deep with the layers, but this is the area where it is. The serratus or the serratus anterior is a fan-shaped muscle deep to the scapula, deep and inferior to pectoral muscles on lateral rib cage. The origin is the lateral aspect of ribs 1 through 8 or 9, and the insertion is the vertebral border of anterior surface of scapula. So these have serrated edges, and that's where they get their name from, which makes them easier to identify on a cadaver. The action for this one is the prime mover to protect and hold the scapula against the chest wall, and it rotates the scapula, causing the inferior angle to move laterally and upward. It functions with abduction and the raising of an arm, so it's often called the boxer's muscle, because being able to raise the arm like that allows for like uppercut movements and things like that. And it's outlined there, up arrow for up motion. In these pictures, you can see clearly the ribs as well as the anterior surface of the scapula. We have a model where you can see the fan shape quite similar to the shape of the pectoralis muscle. Next, we have the pectoralis major, which is a large fan-shaped muscle covering the upper portion of the chest. The origin is the clavicle sternum cartilage of ribs 1 to 6 or 7 and aponeurosis of external oblique muscle. The insertion, fibers converge to insert by short tendon into intertubercular sulcus of humerus. So that is a lot of complicated terminology, but hopefully you can get the gist if you know about the obliques and the parts of the humerus. So the action for this one is a prime mover of arm flexion. It adducts and immediately rotates arm. So basically it brings the arm towards the body and it pulls the chest upward also. Some people, can move these like The Rock by themselves. He's got good pec muscles. Here is a quick video just to show some medial rotation of the humerus, which is done by the pectoralis major. And here's a picture that shows the origin and insertion points for this muscle. So we've got the clavicle, the sternum, we've got the ribs, as well as the humerus. And here we have a model. This is another one of those really easy to find and identify ones on anything, which I really love. So there it is, circled in purple. Next, we have the deltoid, which is a fleshy triangular muscle forming shoulder muscle mass intermuscular injection site, and it's named for its shape. The origin is the lateral third of clavicle, acromion, and spine of scapula. The insertion is the deltoid tuberosity of the humerus. And it is kind of shaped like a triangle, as you can tell. The action, the deltoid is a prime mover of arm abduction, so kind of the opposite of the pectoralis major because it abducts or moves the arm away from the body. It's a synergist in flexion, extension, and rotation of the arm. And here we can see the clavicle as well as the acromion and spine of the scapula and the humerus also. On the model, another easy to identify muscle kind of covering the whole shoulder area, we see the deltoid. This little diagram shows arm abduction, which is done by the deltoid as we just went over, and also arm adduction, which is done by the pectoralis major. Just demonstrated there with a little guy. The supraspinatus is a rotator cuff muscle obscured by the trapezius. The origin is the supraspinous fossa of the scapula, so as the name would indicate, and the insertion is the greater tubercle of the humerus. You can see it, it's the only one in green on this picture. The action for the supraspinatus, it initiates abduction of the humerus, and it also stabilizes the shoulder joint. So the glenohumeral joint, which is a ball and socket joint, as we know, abduction means it moves away from the midline. And again, we have this little diagram showing abduction, which the supraspinatus aids in. Next, we have the infraspinatus, which is a rotator cuff muscle partially covered by the deltoid and trapezius. It's below the supraspinatus. You can see a larger muscle there. And the origin is the infraspinous fossa, as the name would indicate, and the insertion is the greater tubercle of the humerus. The action for the infraspinatus muscle, it does the lateral rotation of the humerus and helps hold the head of the humerus in the glenoid cavity to stabilize the shoulder. So again, this involves the glenohumeral joint. And again, we have this diagram which shows lateral rotation of the humerus, so this is the opposite action of the pectoralis major. Next, we have the teres minor, which is a rotator cuff muscle. It's a small muscle inferior to the infraspinatus that we just went over. The origin is the lateral margin of the scapula posterior, and the insertion is the greater tubercle of the humerus. The function is the same as the infraspinatus, which is the muscle right above it. So again, same as the infraspinatus, this muscle also aids in lateral rotation of the humerus and stabilizing the shoulder. Okay, so next we have the subscapularis muscle, which is deep to everything else that we just went over. The origin is the subscapular fossa. The insertion is the lesser tuberosity of the humerus. The action for the subscapularis, it medially rotates the arm and stabilizes the shoulder. So again, this involves the glenohumeral shoulder joint, ball and socket joint. Here we have a scapula, so we can locate different points. We can see the supraspinous fossa, the infraspinous fossa, as well as the lateral side of the scapula, and then kind of the underneath, point to the underneath area where the subscapularis is located. Can't really locate all of the rotator cuff muscles specifically on this model very well, but you can see the general area and some of the bone markings. Next, we have the latissimus dorsi, which is a broad, flat muscle of the lower back, lumbar region, and it has extensive superficial origins. The origins are the indirect attachment to the spinous process of lower 6 thoracic vertebrae, lumbar vertebrae, last 3 to 4 ribs, as well as the iliac crest. So as you can see, that is extensive. And the insertion is the floor of the intertubercular sulcus of humerus. As you can see, it's a very large muscle, another one of those easier ones to identify. The action, the latissimus dorsi, is a prime mover arm extension. It adducts and immediately rotates the arm and brings the arm down in a power stroke in a striking blow. So this is also called the swimmer's muscle. We have some bone pictures to show some origin points. So we've got a rib as well as a thoracic vertebrae shown in the spinous process is circled. Here we have a picture of the pelvis so that you can see the iliac crest, which you can easily palpate your own. Finally, we have another picture showing the ribs as well as the humerus. Here we have a model. Again, this is one of the easiest muscles to identify anywhere. We have this diagram again showing medial rotation, again that goes towards the midline of the body, and the latissimus dorsi is acting with this and is acting when you do a power stroke or a swim. And here's the diagram showing adduction and abduction. And again, the latissimus dorsi acts in adduction and medial rotation, so it makes sense that those things will go together because they go towards the middle. Moving to the arm, we have the biceps brachii, which is the most familiar muscle of the anterior humerus because this two-headed muscle bulges when the forearm is flexed, so thus the biceps name. The origin for the short head is the coracoid process. For the long head, it's the supraglenoid tubercle and tip of glenoid cavity. Tendon of long head runs in intertubercular sulcus and within capsule of the shoulder joint. So that's a lot there to unpack. And then the insertion is the radial tuberosity. So that is a lot simpler. But as you can see, if you look at the picture, you can see the biceps brachii running down to the radius, so that makes sense. So the actions for this one are flexion, this is very powerful, and supination of the forearm. So a saying to help remember this is it turns the corkscrew and then it pulls the cork out. And the biceps tendon acts in this as well in these motions. So here we have a side view of the scapula where you can see the glenoid cavity because again the glenohumeral joint is involved here. You can also see the coracoid process. And then we have the radial tuberosity also, and because the elbow joint is also getting involved here. Finally, we have the biceps brachii on a model. It's an easy arm muscle to identify. So moving kind of directly down from the biceps brachii, we have the brachioradialis. So this is a superficial muscle of the lateral forearm, forms lateral boundary of cubital fossa. The origin is the lateral ridge at the distal end of the humerus. As you can see, it is on the lateral side of the arm. And the insertion for this muscle is the base of radial styloid process. Which makes sense if you look at the picture. You can kind of guess what the origin and insertion are for this one. For the action, this one is a synergist in forearm flexion, so it kind of acts with the biceps brachii. Here we have bones, so we have the radius, the ulna, and the humerus shown in these images. You can see the lateral side of the humerus, and you can also see the radial styloid process, that part that kind of goes down and has a tip. So this is also moving towards the wrist and those joints. And then again, we have a model where you can see this muscle on the lateral side of the forearm. As the last muscle for this video, we have the triceps brachii, which is a large fleshy muscle of posterior humerus, and it has a three-headed origin, as the name triceps would imply. The origin for the long head is the inferior margin of the glenoid cavity. For the lateral head, the posterior humerus. For the medial head, the distal radial groove on posterior humerus. The insertion for this muscle is the olecranon of the ulna, so that's the muscle besides the one that is the insertion for the biceps brachii. The action for this muscle, it is a powerful forearm extensor. It is the antagonist of forearm flexors, so the brachialis and the biceps brachii. And again, here we have a side view of the scapula, so we can see the glenoid cavity, which is very important for a lot of arm and shoulder muscles. And then also we can see the radial groove on the humerus and the olecranon on the ulna. Again, we are moving into the elbow joint also. And here we have a model where you can see the triceps brachii located on the posterior part of the arm. Here is another diagram showing arm flexion, which, as we just went over, the biceps brachii and the brachioradialis participate in. So the arm is moving forward and flexing. And then on the other side of the diagram, forearm extension is shown, which is the opposite movement, which is done by the triceps brachii, which is why it is an antagonist for the biceps brachii. And lastly, we have a diagram showing supination and pronation, and as mentioned previously, the biceps brachii acts in supination, so turning the palm. Thank you for listening. I hope that this video was informative. Have a good day.